We'll get started here in a couple minutes. I'll let more people join. Hope everybody's doing well today. I don't know about all of you, but I do much better on days when the sun is out, and today is a perfect specimen. So I see a number of people still coming in. If you're just joining us, please do write your name and affiliation in the chat box. That'll be helpful for the speakers and everybody to know who's in the meeting. Okay, I have 103, so I'm going to go ahead and get started as we have a very full agenda today. But I wanted to welcome everybody to our October McHale Network meeting. Today's topic is vital services for learners. And today's objective is really to help equip program managers and instructors with information that could be helpful to the learners that they are regularly engaging with. We did a similar meeting in April, but a lot has happened in the last several months. And actually, it so happens our timing was lucky in setting this meeting, as some of the county programs have actually have new phases now, or are new as of last week. Without further ado, I'd like to introduce our speakers today. We're very lucky today to have Susan Kornacki and Allie Sklarew from the Montgomery County Food Council, and they'll be talking about food security, a little bit about the food security situation in the county and available assistance. And we'll have Dianna Tato from the Department of Health and Human Services, and she's going to be talking about consolidated service hubs, which is a very interesting development. Next, we'll have Hannah Roberts, who is also with Health and Human Services, to talk about, I believe it is the second phase of the COVID rent relief program. And then finally, Richon Nembhard, also from Health and Human Services, to tell us about two programs, one of which is the Emergency Assistance Relief Program, which I believe is renewed. She'll tell you about that, but also a new program of financial assistance for school-age childcare. Let me stop sharing here, and we'll get started. We have 1 hour and a very full agenda, so we will be taking questions through the chat. So please, as you're listening, feel free to put your questions there. My colleague Halima Ahmed is with me today to help with the questions. We also have other staff members, Christine Neal, and I believe Monica Casanes is also online. So with that, and please keep yourself muted if you're not speaking. Thank you. So we are recording this session, so you'll be able to come back to it if you need to remind yourself of any information. But with that, let's ask Susan and Allie to start us off. Oops.
Sure, thank you very much for including us. My colleague Allie is graciously sharing our slides right now. Thank you, Allie. Good afternoon, everybody. My name is Susan Kornacki. I'm the Interim Food Security Programs Manager at the Montgomery County Food Council. It's so nice to see you all today, and we very much appreciate the opportunity to speak as part of this panel, so thank you. So I'm going to open by providing a little bit of information about our organization for those who may not have heard of us before, a bit of background and context about food insecurity as various aspects of it impact Montgomery County communities, some information on how COVID-19 has changed the landscape of food insecurity, and then we'll transition to applicable resources, which Allie will focus in on in the second half of our presentation. So next slide, please, Allie. Thank you. And so just to give you a little bit of background about our organization before I jump into the data that we have looked at closely over the last couple of years. For those who may not know us, the Montgomery County Food Council is a 501c3 organization. We are one of about 300 food policy councils all throughout North America and other parts of the world. We have 25 volunteer council members who graciously volunteer their time and their expertise to represent perspectives from all across the food system so that we can make sure that our organization, as much as possible, takes a systemic, thoughtful, intentional approach to creating a food system that is more sustainable, equitable, just, and resilient, and serves all of us in as many ways as possible. And so to get that work done, we prioritize a variety of strategies. We work to increase the capacity of local programs, businesses, and organizations. We grow and strengthen networks and partnerships. We lead advocacy and drive policy and process change. And we research and provide up-to-date information on specific issues within the food system so that everyone who is working collaboratively on these issues has the best, most up-to-date information possible. And so to that end, I just wanted to give a little bit of level set information about how our organization talks food insecurity. There are many varied, complex, and interconnected root causes for food insecurity, which can include transportation, access issues, disability issues, as well as, of course, housing and income and several other components. As I'm sure you all know, cost of living is extremely high in Montgomery County, and the estimated income that is required in order to meet basic needs in a county with a cost of living such as ours is just over $90,000. And so, given those circumstances, there are certain parts of our communities that are impacted by food insecurity. In 2016, which is about when this map and data is from, about 60,000 residents were estimated to be food insecure in Montgomery County, including 30,000 children. And Montgomery County government committed to creating a strategic response to respond to that issue. If you could please go to the next slide, Allie. And a food security plan was developed, and this included input from, I believe, over 300 stakeholders who engaged in several listening sessions and provided a great deal of feedback throughout the fall of 2016, with the plan being finalized and released by the county executive in January of 2017. Having this plan in place really did position Montgomery County well to mobilize several strategies as soon as the impacts of COVID-19 became evident. Next slide, please. And so one last point I want to make quickly about the landscape of food insecurity in Montgomery County before I talk a little bit about how COVID-19 changed things is that the disparities are significant, even looking at the data from before COVID-19. Health impacts of hunger disproportionately affect our county's children and people of color. And according to recent data from the Maryland Department of Health through their Maryland Youth Risk Behavior Survey, which was in the pandemic, of middle school students and 22% of high school students in MCPS are food insecure, with African American or Black identifying students 5 times more likely and Hispanic and Latino students 6 times more likely to be food insecure as compared to their white peers. So I wanted to acknowledge that and acknowledge that there's a tremendous amount of work to do to try to close some of these gaps and just do better by all of the students in our community. Next slide, please. And so with COVID-19, we did see poverty really on the rise. There was a significant increase between 2018 and 2019 data, and then again further into the spring of 2020. This is from the American Community Survey. I'll note that data is still being collected to have specific numbers about how food insecurity is specifically impacting every single zip code in Montgomery County. But to this point, we estimate that at least 100,000 residents are impacted by food insecurity at this time, taking into consideration a few different factors, including unemployment rate and number of claims filed in the county at this time. Next slide, please. And so to make sure there's a coordinated and effective response to this, the Montgomery County Food Security Task Force was established to increase the volume of food assistance in the system, improve access to culturally appropriate and nutritious food all throughout Montgomery County, and to communicate information clearly to residents to make sure everyone has up-to-date, useful information about where to access food assistance resources, which I'll speak about a little bit more in a moment. Next slide, please. And so the Food Council's role in the work of the task force focuses in on two specific categories: connecting and supporting community providers, organizations that are assisting residents who are dealing with food insecurity and with hunger at this time, and then connecting residents directly to food assistance resources. So for part one, for where we connect and support those community providers, the Food Council makes sure to provide and collect clear, up-to-date information about service hours and accessibility for the many different food assistance organizations throughout the county. To date, that we know of, there are at least 100 organizations working very hard to serve residents who are experiencing hunger at this time, and we convene them on a biweekly basis for Zoom calls that are sort of like community meetings and resource sharing opportunities when 100 or so food assistance providers get together, join in conversation about what's working and isn't, and what they are learning in their day-to-day efforts. And that's also where the Food Council shares information about resources or up-to-date information on policy changes or funding changes or changes in the federal policy landscape that impact the work of the food assistance providers. So that's another strategy we use to support our partners. And then identifying best practices for food assistance providers and making sure to provide training opportunities and ways folks can access the best information possible. As far as connecting residents to food assistance resources, we have an interactive food assistance resource map that Allie will speak about momentarily, so I won't jump the gun too much there. We also developed and continue to share a food assistance referral tool, which we'll go into a bit of detail about shortly. Additionally, we make phone calls to Maryland residents to provide food assistance resources and to schedule appointments so that residents who may be eligible for the Supplemental Nutrition Assistance Program can go through a simple screening process and find out pretty quickly if they are eligible and can move forward with the process to apply for SNAP benefits. We conduct those calls in English and in Spanish, thanks to a partnership that we're very grateful to have with Identity. And we share other resources related to food assistance and volunteering opportunities and work to support small businesses through a time that is very challenging for them as well. Next slide, please. And so with that, we're ready to dive into the map. Allie, over to you.
Thank you, Susan, and thank you all for having me. Again, I'm Allie Sklarew, Program Assistant for the Food Council. And now that Susan kind of gave an overview of what the food security landscape is, I wanted to show kind of the tools and what we're doing. So the first thing that we have is our Food Assistance Resource Map, or formerly known as FARD. So our FARD map is a list of our 100 plus providers that Susan mentioned that have a list of all the providers there that residents can usually use as a simple tool to research a place to get themselves food. So there's filters and different ways to search. So the map has all different information on location, hours, types of services, languages, anything that a resident might need to consider when seeking this assistance. So there are ways to search by name. You can search by an address, what's closest to you. And then for some of our residents who might be homebound or that have other restrictions, you can also use the show filter situation to help with that. So this is a great first step to put in the plugs about what is best for you for the fit, and then you can usually find a food assistance provider that's willing to help. And then our other tool is our food assistance referral tool. So this is something that we kind of made that was new here. But basically the idea of this referral tool is it's almost like a flow chart or decision tree that kind of helps people, whether you're a partner or a resident yourself, being able to go from one by one to figure out what's the best next step for you. So we kind of have information here about if you are able to purchase food, how you can actually get it, whether they have grocery delivery, curbside pickup, or other takeout options. Then we get to the more in-depth information where you cannot purchase food. So then we also talk about our food assistance resource map, as well as we just talked about, and also information about SNAP or supplemental nutrition. There, after that, you go to the different section that you're in. So whether you're 60 plus, pregnant, or a child under 5 in the house, children under 18, and also farmers markets and homebound disability. And there we'll give you a list of resources, exactly what would be able to help you. And we also know that food insecurity is not a one-dimensional thing. There's many other things that people are facing just because, in addition to food insecurity. So we have a list of additional resources here in case people need help with mental health, energy assistance, childcare, anything like that. And then this part kind of goes into more detail with the websites and phone numbers to call. And then this is kind of, again, what Susan was talking about, joining our bi-weekly calls that bring our providers and our food security groups together as well. And then our COVID-19 response research page has information of residents, community partners, and businesses and farms that are often updated in there to help people. And then real quickly, I know we're probably over time soon, but also our 311 call center, which is something new as well, which is basically now if you call the county's 311 or helpline, you can ask for the Food Access Call Center, and the Food Access Call Center will give you a call back and provide referrals information for any resident who needs support. So they can help in multiple languages as well. And again, this is just more information, overview of what we have, but that is pretty much it on my end. And thank you so much for letting us present.
Thank you very much, Susan and Allie. We really appreciate it. Are there any questions at this time?
We don't have any yet.
Okay, well, people should feel free if they think of one later to add that to the chat, and we can always address it a little bit later. And I see that Susan has also provided some information in the chat about the biweekly meetings. So thank you very much. I think that we'll at this time then move on to Dianna to talk about a very interesting development in terms of the consolidated service hubs. And I believe this started with the BlackRock Center for the Arts in Germantown. Is that correct?
That's right, Rudy. Thank you so much. And hello, everybody. Thanks for having me. My name is Dianna Tato, and I am the program manager for the food security plan at the Department of Health and Human Services. And I work very closely with Allie and Susan and the rest of their team. They are our nonprofit partner in the food security plan and the main partner for the food security efforts and the food security task force that we are doing right now. And yes, it all started with BlackRock. And I'm gonna see if I can share my screen so you can rest your eyes on this. Let's see. So the, I always have a problem with this. There you go. Thank you. So the concept of the service consolidation hubs started with the BlackRock. BlackRock Center for the Arts, as you may know, is a place where art is shown, and there is theater, and there is dance and ballet and concerts and things like that. And that was closed early April because of the pandemic and the shutdown. And so what happened was that the people that work there, their board of directors, their volunteers, their workers, decided that this was at the same time that it was a terrible thing, it was also an opportunity to use their space to do something really good for the community. And they pivoted and they turned things around, and they converted their art gallery and their dance room into places for storage for food, for diapers, and for spaces for volunteers to work assembling food baskets. They called donors, they asked the whole community to come on board and help. And that's how the first consolidated hub started. So that actually caught the eye of our leaders in Montgomery County and the county council, and they decided to allocate funds to support the creation of 7 more hubs in the county to help meet the needs of the most affected community members during this pandemic. So they allocated funds, and they are providing funding for staffing and also infrastructure and capacity building, and also support for food so that these places can help the community. The organizations that are being the host of these service consolidation hubs are organizations that were already strategically located in places of high need, and that also are accessible geographically and physically. These are organizations that we're already making a difference in the community. We're already engaged, but wanted to make a larger impact during this difficult time. That the vision of the hubs that our leaders have is that of a place that, first and foremost offers food, because food insecurity is, as Susan explained, in the rise in a very difficult moment. So food is number one, being provided at a low barrier or no barrier model, and in a way that really helps people who are the most vulnerable. But aside from food, the service consolidation hubs are designed to also provide other supports to our most underserved communities. Another key factor is that they are providing services in a way that is culturally appropriate, because many of our most vulnerable citizens are also immigrants that don't speak English very well. And so that is a very important piece. And let me see, sorry, I got myself ahead of me. Okay. The hubs are to draw on the strengths that already exist in the community. So just as Black Rock did, hubs are bringing in businesses and volunteers and advocacy groups and other partners to collaborate and better serve the community. Also important is the fact that the hubs are not government buildings. They are not seen as a government entity. They are a community-based effort, and they are also at a very short distance from the homes of our participants. So people don't have to get and take 2 buses to go to a place to get food and other things. The services that are being provided at the hubs, and just so you know, some hubs are more developed than others, or some are just beginning to build their capacity, others are very well established. But aside from food, they are providing diapers, and either now or in the near future, we hope to be able to offer applications and referrals for SNAP and other food benefits, as well as information and referral for programs such as rental assistance, cash assistance, and other services like that. Some hubs are beginning to establish relationships to provide mental health services, working with safety net organizations to do that, as well as health promotion and health services. We are doing COVID-19 testing at several of the hubs and exploring providing flu shots, and also things like educational support. Basically, we want that any service that is provided by our county Health and Human Services Department and our partners, that is accessible to the people who come to the hubs. Here is a map where you can see what the location of the hubs are and who they are. So right now we have 7 hubs close. Soon we will have 8. The first one is the Germantown Consolidation Hub. We also have the Gatorsburg Hub, hosted by the Seneca Creek Church. We have Olney Hub, hosted by Bethel World Outreach. The Oaks Chapel Hub in the area of Belpre, Lake Hill Road, that is going to open on October 22nd. We have Hughes United Methodist Church covering the Glenmont-Wheaton area. And in Silver Spring, there is Clifton Park Baptist Church. And the East County Hub is at Kingdom Fellowship. So that's what we have. And here, and I'm happy to share this information with you, this is the list of the contacts at the hubs that your teachers and your organization is welcome to get familiar with. And the hubs will take referrals for food assistance. Some of them have food distributions that are open to the public, most of them, but some of them provide help on a home delivery model only. All of them should be able to meet referrals for emergency food for people who are sick with COVID and cannot go out, or are high risk and should not go out and need food delivered to their home. Also for those families that have young kids or single parents with children who don't have transportation, it's very difficult for them to go to a place and get food. That's what the hubs are made for, so that they can help those families. And that is all I have. Happy to take any questions.
Thank you very much, Dianna. So just a follow-up question is, are the addresses you gave are the ones that are up and running right now, the ones you mentioned that are the most developed and have services, right? And then.
Yeah, so what I can do is certainly share the slides, and the last two slides have the contact information of the hubs. The ones that I presented are the ones that are already operating. It's just that the one that is opening on the 22nd, well, we'll have to wait one more week for that one. But you should feel free to contact any of them if you have clients or students that are in the nearby area and need support.
It's interesting. I was noting that 2 of the organizations actually have adult ESOL programs as well, Seneca Creek Church and Hughes United Methodist. So that's interesting. And thank you for sharing your slides. As Halima says in the chat, we will follow up with the meeting materials. If there are not any questions right now, I'd like to actually take a few moments and do something that I was supposed to do in the beginning, but it might not be a bad time to do now. We would like to hear from our audience, our program managers and instructors, on what concerns they are hearing about from their learners. So I'm going to launch a poll, and please choose what are the top 3 concerns of your learners. We ran a similar poll in our meeting in April, and we're interested to see if there is any change.
We do have a question in the chat about if clients are receiving food from MANA, can they also receive help from the hub?
Dianna, do you know the answer to that question?
Yes, thank you. I was answering in the chat, but absolutely. So receiving food from any other source does not prevent participants or people to go to the hub and receive food. MANA gives food once a month. That's not going to be enough for anybody in these circumstances. So yes, go get food from MANA and go get food from other sources. Go get food every week so that they have sufficient food for their family. Does that answer your question?
Yes, thank you. So I'm going to share the results of our poll here. It looks like food is the main concern of many of our learners, followed by housing, which will include rent and utility payment. And then I guess next would be healthcare, internet access, mental health, and accurate information on COVID is still there. So that's very useful. Thank you everybody for participating in the poll. So, and I'm glad that we are addressing some of these main concerns today. Our next speaker is going to be Hannah Roberts, and she is going to be telling us about the next phase of the rent relief program.
Hi, everybody. I'm happy to be with you today. I will, of course, keep my comments fairly brief because I know there's a lot on the agenda. But when I'm done speaking, I will put my contact information in the chat box, as well as some links to the website so that you can find some of the information that I reference. And then I'm happy to have follow-up conversations with folks if they want to talk in more detail. And we'll, of course, make these slides available as well that I should start sharing now. Okay, so as was stated, I'm with the Department of Health and Human Services, specifically within the Department of Services to End and Prevent Homelessness. I am not going to talk about all of the services provided to address homelessness in Montgomery County today, but I'm certainly happy to answer follow-up questions. But of course, this office is responsible for all of the countywide strategies to both prevent and end homelessness for individuals and families in Montgomery County. Just as a little preface to what I'm going to talk about today, I'm just showing a couple quick slides on trends related to homelessness and eviction. This is actually national data that's pre-COVID, which I just used to give a little bit of context that we were certainly already dealing with an affordable housing crisis before COVID started, as I'm sure many of you all know and understand from the work that you do. This shows the number of families, obviously in the millions, that were experiencing considerable financial stress related to their housing. So we typically talk about being severely housing cost burden when a family's paying more than half of their income towards their rent. And you can see that this is even before COVID, a very large number of households in the US. And so, of course, our concern now is that with the COVID crisis, that even more families nationally and even locally are at risk of losing their housing due to the cost of their housing as it compares to their income. And then this is also just additional national data, just pointing out quickly the racial disparities that we see within the homeless service system, even when controlling for poverty. We see these trends nationally and locally here in Montgomery County. So you can see this here is the national data, but we are particularly interested as we roll out programs related to COVID and making sure that this information is accessible to folks that are overrepresented in the homeless service system and have been targeting some of the outreach to address that. So I will spend most of my time talking about the COVID rent relief program, primarily because it is currently available, meant to be addressing the current crisis, and is a considerable amount of money that's available now and over the next couple of months. The rent relief program, it is a second phase. There was a smaller first phase earlier this year, but it is the second phase is based on $20 million that was allocated by the county council earlier this summer, specifically for rental assistance for households impacted by COVID. It's available to us through CARES Act funding and is being administered, of course, by the Department of Health and Human Services. It is short-term rental assistance, and it is to households who have experienced a financial loss related to the COVID pandemic that has caused them to fall behind on rent. It is up to $4,000 per household. It is open to households that are in both formal and informal leasing situations. So that includes, for example, a family or an individual who may be renting a room from someone but doesn't necessarily have a lease agreement. We would still encourage them to apply. Immigration status is not a factor for the rent relief program. We are not requiring Social Security numbers or birth certificates. And applications will be prioritized based on areas that we're calling high impact neighborhoods that I will explain here momentarily. Just a little bit on the eligibility. This is all listed on fact sheets that we have in 7 languages on our website, so I'll include a link to that. But here they are briefly. I mentioned a couple of them already. There are additionally some income requirements, but we are looking specifically at the last 30 days of income. So families shouldn't feel discouraged if maybe they had a job paying quite a bit of money earlier in the year and now don't, we are not going to be tracking back across their income over the entire year. We're really looking at their financial situation in the past 30 days. It does require having lived in Montgomery County since February because it is a local program, so it is not open to residents of other counties or folks that recently moved here. And again, it does require that folks are already behind on rent. The ways that people can apply. So the one that we're encouraging people to do if they are able is to go online. That's kind of the quickest and most straightforward way to do that. It's a fillable form online that can be, there's like a Google Translate function where people can shift it into a different language if they need or want to. And it just asks them for their basic information. We have really reduced the amount of documents we're collecting to make this more accessible. So most of the information that they're required to submit is just done through that form, and they self-certify at the end of it that the information they're providing is true. The only 2 documents that will be required are a copy of a photo ID to verify the person's identity. Any kind of photo ID will suffice, and a copy of the rent ledger or some kind of written documentation that shows the person's behind on rent and what their monthly rent is. So that online submission is the first option. It's available on our website. If folks are not able to do that, the second option would be to call 311. They will take down the individual's information, and then an eligibility worker will call them back to collect that same information that's collected in the online form and work with them to figure out a plan for making sure they can get their documents in. Again, that's just the 2 documents that are required. And then on a limited basis, we've been sending out some outreach workers. We're doing this ourselves at DHHS as well as with some nonprofit partners in the community. Because there's limited capacity right now, we're focused on going out to large multi-unit properties in the county, particularly those in the target areas that I'll show you in a moment. And I should mention here that for those of you that work with individuals, it is certainly acceptable to help people through this process. So there's even a question in the online submission form for whether or not someone helped you and their contact information. So if you work directly with people and typically help with things like application submissions, you are certainly welcome to assist individuals in person or by phone to complete this process. And then just quickly, this is the Homeless Prevention Index, which was used to determine priority or high impact neighborhoods. I mentioned at the beginning of this mini presentation that we see disparities in the homeless service system, and part of DHHS's commitment is to addressing equity within the homeless service system. And so in response to that, this Homeless Prevention Index was developed to identify neighborhoods where there is the most instability and need and the largest kind of tendency to be underserved by our traditional systems. So you can see on the left the different factors that went into that index. That includes the impact of the pandemic itself, as well as general housing stress in neighborhoods, irregardless of the pandemic, and then social determinants of housing stability as well. And so all of that was used to calculate which neighborhoods should be the focus for this. I want to emphasize this does not mean that those are the only neighborhoods that are eligible. It is open to any resident in Montgomery County, but we are starting by processing applications from those target neighborhoods, and will continue to keep others on a wait list and serve them, only as capacity allows. And quick note on the timeline, there is not a specific deadline, but we must use all funds by the end of December, and funds may be used before then. So we are encouraging people, as soon as they're behind on rent, we know that that's an incredibly stressful and traumatic situation to be in, but encouraging people nonetheless to reach out for help as soon as they're behind on rent and not wait until things get worse or potentially till funds run out. So we are actively processing checks now. We started that process in early to mid-September, and we'll continue until we've spent the money or the end of the year. just a quick note, I will not go through this in detail, but I'll send this to you. As I said, I was mainly focusing on the COVID rent relief program, but there are other eviction prevention programs, as well as broader homeless service programs within DHHS. These are two of the eviction prevention programs that are specifically for families experiencing a high degree of housing instability, or what we'll often call an imminent risk of housing loss or homelessness, attempting, of course, to divert them or prevent them from entering the homeless service system to begin with. And these are programs that are not related to COVID, the CARES Act or COVID funding. So they are looking really at the situation of the family year round. And so these are also available. So as we all know, there haven't been a lot of evictions being processed since the pandemic started, but these are year-round programs. And so if a family finds themselves in a situation where they might be eligible, they can call 311 to access either of these services. And that is it. So I'm happy to answer quick questions if folks have them, but as I said, I'll put my contact information in the into the chat box, and feel free to reach out to me as well.
Thank you very much, Hannah. That was a lot of very useful information in a very succinct manner. So thank you again. Just stop for a second to see if there are any questions.
I do have a question.
Yes.
Hi, Hannah. I was wondering, have you heard of any issues that people have when they try to submit the application online?
I have not. Have you? Oh, no, I haven't.
No, it's just because, you know, with the groups that we serve, many of them are not that, you know, very technically savvy.
Mm-hmm.
And sometimes the translations are not really
The best, yeah.
good. So I was just wondering, and I have experienced the issue with the SNAP application, with the MD SNAP application, that has been a problem for some people. It kind of poses some barriers. So I was wondering if there have been any that you were aware. But I say that because I am already thinking about how the hubs could help with this, and I know you and I had conversations on that. And I'm wondering if it is difficult for people to submit that online, could we have a helper? Could we have a volunteer help them complete that online, because it's the fastest way?
Yes, so it is. I mean, one, I will reiterate, people can call 311. So it's the same process. It's just that someone's going to call you back if you call 311, whereas if you do it online, it's going in right that moment. But either will work. They go into the exact same database. So folks can continue to use 311 if that works better for them. But absolutely, if agencies have the capacity to help people complete that, whether you're able to do it in person or you want to do it over the phone, it's really basic, pretty straightforward information. Another thing that I think is a challenge is that even if people, whether or not people are able to do it online, some folks will struggle with being able to upload the documents. And so just so you all know, that doesn't, if their application comes in without documents, it will still get assigned, assuming it's otherwise eligible to be assigned. And then someone will call them and work out a plan for them to submit their documents. So they could work with somebody to help them. They can text it to a worker, or they can, even if they need to, figure out a way to do a physical drop off or something like that. So I think that is one thing we've anticipated as certainly a challenge. It's also one of the reasons we're sending out outreach workers. Of course, we're not going to get them out everywhere, but have really targeted large multi-unit properties where we know there's high turnover, to make sure that as much as we can, that we're sending someone out there in person to help folks, particularly if they're otherwise going to be unsure of how to apply or unable.
We have time for another question. I'm just going to read this from the chat. Most of our clients share rooms or are boarders. How to apply and what papers are necessary?
It is. That's a great question. It's the same process, with the exception that typically if you're in a formal lease agreement, we're just taking a rent ledger from the property owner. In that situation, they are going to need something in writing from the person that they're paying for rent to, verifying that they're paying rent to that person in this amount and that they're behind by this much, so that we have verification of that informal situation that can be written in any way. If folks have questions specifically about that on a case-by-case basis, there's some, because those are informal situations, I'll just tell you, our goal is we don't really care, right? We want people to stay in their housing, and let's try to figure it out. But we know that can, when people are not on a formal lease, that can sometimes be a little bit complicated to navigate. We certainly don't want to get them in trouble with a landlord that may or may not know that they're renting there. We really don't need to know what that situation is, but we do need written verification that there is an agreement in place and that they're behind. So that could be just a simple written statement that's scanned, or a picture of it's taken, or it's emailed to verify that. And then if and when the person's approved, in most cases, that check will go directly to that person that they're paying.
Okay, thank you. There's one more question in the chat, but if you don't mind, Hannah, if you could answer that online, where I want to make sure that Richon has enough time to present about her programs. Thank you. Thank you. Richon, thank you for being patient. Please tell us about the programs that you are going to tell us about.
Sure, and I was going to start with the school age, but I think I'll start with ERP to follow up on the SEP one, because it's kind of this. You can see my screen.
Yes, I can.
Okay. So emergency assistance program started in April, and we've been through a couple of phases, and I think the phases kind of implied a certain type of change that wasn't necessarily an explicit requirement change from the perspective of the client. So the client requirement around this program for phase 1, 2, and 3 were all the same, which are the same kind of requirement for the rental assistance program. You live in Montgomery County. The other piece for us was that you would not have qualified for the federal stimulus, because we were trying to help people who were outside of that population. We targeted families that were 0 to 75% FPL. And we brought it through phases because in phase 1, we identified current clients we were already serving that we know fit that criteria. So we kind of did an outreach from our system, and we were able to verify addresses and send those clients checks. So that was practically phase 1, but the requirement for the client stayed the same. Phase 2 was when we brought partners to help us, community partners to help us process application. So we had like an entry point. That's what we added in phase 2. But again, the requirement for the client stayed the same. Phase 3, when we had the internal HHS program added as an entry point. So I think in those phases, people thought the requirement changed, but no, the process changed, and we added entry points for clients to get the services. Phase 4, which is where we are. So phase 1, 2, and 3, phase 1 was the only one that was like a one point in time. We identified clients that were on our roster. We reached out to them, we send them a check. That one is kind of closed. But phase 2 and 3, where a partner can process an application for a client, or an HHS program can process an application for a client, that still remains the same. Phase 4 is where the requirements actually change because we expanded it, meaning we have gone from 0 to 75% FPL targeted population to 0 to 150 FPL. So we've gone from 75 to 150 because we wanted to expand that to another set of the population. And what we did was we made that distinction because we felt like we needed to be more hands-on with people in the lower FPL, with the lower income. And so we had those one-on-one help with application processing. With phase 4, we've gone completely online, where there is an online application. It is as simple as the rental relief application. And it's in multiple languages, of course. And what we did on our side, we kind of re-engineered the translation. So we went from Spanish to English, if it made sense, and Spanish to English. So we made sure that it made sense in the language, and we would change the English to make sense in the translation. So We haven't had many complaints or any complaints around the online application. We started that last week, Monday. So far, we're almost up to about 350 applications in the queue. And we still have partners processing. So we do also have another access for clients who have received a check in a previous phase and either requesting a second check or is requesting an address change or a name change, or they forgot to add a family member. We do have an outlet for that. They also can provide that information back to us online and we can process that. So the requirement is still the same. Family must live in Montgomery County, not eligible to receive the federal stimulus. And we've expanded the income levels to 150 FPL. There's also another added piece where we're now encouraging families who have been COVID positive since October 1st to apply for this funding. So that is if you have received the federal stimulus, but you're COVID positive, you can receive assistance from this program. I hope that didn't complicate stuff. That was an addition that we did for phase 4. Because the program itself is really geared towards those who never had access to the federal stimulus. But there's one criteria in phase 4 that if you are COVID positive and we just think it's a hardship on top of what you have, we will provide you a benefit from the program. So that's the only piece where if you had received the federal stimulus, you would qualify for this program. Because we expanded the FPL, but we also expanded the amounts that we were providing to the 0 to 75% families, right? What happened is that because we've expanded that, we've increased the amount, we're now sending a second check to the families that we already provided assistance to bring them to that amount. This is an automatic issuance, meaning that if you have cashed a check, if you didn't cash a check, we're not going to send one. But if you've cashed a check in any of the phases before, we're just going to reissue you a second check. So you don't need to reapply. I mean, there's a pace where you can say, oh, I'd like a second check, and that's fine. We'll take that information, but we're looking to do that kind of automatically based on your information that you provided before. And the increase in the amount is only for the families 0 to 75. If you're over 75 to 150 FPL, you're still getting the original amount in the program, right? Okay. So the information you would need, oh, I still have the childcare one here. Sorry about that. But the information you would need for this program, it's only your income for the past 30 days, and that can be self-declared in the form. So we're not pressuring people to go to the employer or anything like that. We're just saying if you're unemployed, especially a lot of our population work for cash, you could just say that as a self-declaration in the application itself. That's what we had before. We still need a verification of your family information, right? So your relationship to the child that you are trying to get the benefit for. We don't need Social Security. We don't need any of this. The slide is kind of wrong. The slide is for the school age program. But we only need the information about your family and that you live in Montgomery County. We use the same criteria as Services to End and Prevent Homelessness for the rental receipt relief. So if you're renting a room, we just need a letter from the person you're renting a room saying that you're renting the room here, and that's that. You're able to upload these documents. Clients have been using our site, uploading documents, and we've also encouraged clients to email. So there's an email on the application, and clients are using that email to send documents. So they might forget to upload, or they don't know how to upload. They've been sending the documents in an email to us. So there's an email attached to the actual application.
Excuse me, Rich, I'm just going to interrupt for a second with a time check. We have about 5 more minutes.
Okay.
I gave you an impossible job to talk about these 2 big programs in 10 minutes. But is it possible to share a slideshow later with everybody and then?
Yes, I can. So, but that's basically it for the EARP. It is online. People can apply. In both of these programs, which are online, because I'm gonna talk about the childcare in a minute, the client, if they're computer savvy enough, they do get a status update of their application. So they get a status update if it's assigned, if it's processed, if the payment is sent. That's one of the things that we added because it went online, so they're able to see the changes in their application. For the childcare program, which is a little bit more complicated, I might have should have started with this, is Childcare Subsidy for families that live in Montgomery County that have a school-age child enrolled in distance learning and is attending a full-day MSD program at a licensed provider. Right? So the provider has to be licensed. It has to be a school-age child, so over 5 to 13, and you meet the income criteria. So there are 3 criteria. There's low income, which is the first one. More than likely, we're asking that you apply to the state because this is a supplemental or a subsidy program. So we really want to supplement what you could currently get from a different funding. So we encourage people to apply to the state. If you're in this category, in category 2, you would apply to our county working parents assistance program. In category 3, you would be over 350% FPL, and you would not qualify for either the county or state program, and we will take your application in this program and provide the benefit. There's a 4th criteria, which is not quite explicit here because we gotta be delicate about it. If the undocumented child at MCPS never had access to subsidy, childcare subsidy, because you needed to be documented to have access to the state funds and county funds in this program. And I'm hoping that this team can get the word out. In this program, if you have an undocumented child in MCPS and they meet this criteria, please apply to this program because we will serve you for the 4 months. Okay, they don't have to apply to the state. The application won't ask them to apply for the state. It won't ask them for anything else. It's like they're only applying to this program. And of course, I couldn't put it explicitly in the application, so it's there subtly, but I'm trying to get the word out, marketing around. If you're undocumented, you're an undocumented child, we will able to help you through this program.
Thank you. If you have just like a last point, and then I'm afraid we're gonna.
No, I think that's it. I can share this later. Oh, the last point is the where is that? Yeah. So we have a cap based on center or family, right? So if you're going to center, it's about $1,300 and it's about $1,000 for family. So there's a cap in how much help we will provide based on your childcare provider.
Thank you so much. And I'm sorry to have to rush you. But is there an email address or a contact that you could put in the chat in case people have questions to follow up with?
Yes, I'll do that.
That would be wonderful. In our last,
this is your main doctor, right? Yeah, you have an appointment with her tomorrow. So
you're unmuted. So let's, I just wanted to wrap up by thanking everybody, our speakers for joining us today. It's been a wonderful conveyance of a lot of information that I think will be helpful. So applause for them. Thank you. And thank you to all of our attendees. We'd appreciate if you could look at the chat for the survey that we'd like you to fill out, just an evaluation survey as we do with all of our network meetings. So I'm just going to bring this meeting to a close. It seems so abrupt, but I hope everybody has a wonderful afternoon, and thanks, and be well. Thank you.
Thank you, Rudy and Halima. Thank you all.
Thank you.
Thank you.
Fine. Okay.
All right, thank you.